The lower urinary tract is made up of the urinary bladder and the urethra. The urethra in females is very, very short than that of the males. This, what plane is this? Is it transverse, sagittal, or coronal?
Sagittal plane.
Is it a male or a female?
A female.
A female.
We can see our abdominal wall. We can see our pubic symphysis, the retropubic space communicating with the extraperitoneal fat, the urinary bladder connected to the urethra, and this part of the urinary bladder connecting to the urethra is the neck of the urinary bladder. We can see the vesicouterine pouch superior to it, the body and fundus of the uterus superior also, then posterior to it you have the cervix and then the vaginal canal. Posterior to the uterus you have the pouch of Douglas, posterior to the pouch of Douglas you have the rectum. The structures in the female pelvis shouldn't confuse you whether they are in sagittal or in transverse. So the relations of the urinary bladder in males and in females differ. Posterior to the urinary bladder in which structures are posterior to the urinary bladder in males? Who can labor?
Seminal vesicles.
Seminal vesicles, what else?
The prostate gland.
The posterior lobe of the prostate, but not necessarily. The prostate is inferior. Apart from seminal vesicles, what else is posterior to the urinary bladder in males?
The rectum.
The rectum, what else apart from the rectum?
Rectovesical space.
The rectovesical pouch, what else? There's a structure which joins the seminal vesicles. It moves superiorly, then posteriorly. There's a structure which comes and joins the seminal vesicles. I talked about it. What is it?
Epithelium.
The epithelium is down here. But the structure which comes posterior to the urinary bladder and joins the seminal vesicles, what is it? The vas deferens, and some of you have forgotten it. The seminal vesicles, the vas deferens, the rectovesical pouch, and the rectum, they are posterior to the urinary bladder in males. And posterior to the urinary bladder in females, we have the vagina and the cervix. Vagina and the cervix. Those are the posterior regions of the urinary bladder in females. Superior to the urinary bladder in females, we have the vesicouterine pouch, the body and fundus of the uterus. These are superior relations. The vesicouterine pouch, the body, and the fundus of the uterus. Inferior to it, you have the urethra. Anterior to it, you have the retropubic space and the pubic symphysis. The relations of the urinary bladder in both males and females are similar generally, but the posterior relations and the superior relations are different. The posterior relations, you have the vas deferens, seminal vesicles, rectovesical pouch, rectum. In the female, we have the vagina, cervix. Superior relations, you have the coils of the intestines above for males. And for females, you have the vesicouterine pouch, the body, and fundus of the uterus. Inferior to the urinary bladder in males. What is inferior to the urinary bladder in males? What is
Prostatic urethra.
prostatic urethra and the prostatic urethra and what?
And the other lobes of the prostate gland.
And the prostate, the prostatic urethra and the prostate are inferior in males. Superior will have the coils of the intestines. In females, inferior will have the urethra, and then superior will have the vesicouterine pouch and the uterus. And the posterior relations are also indicated, and they are different. So whenever you're talking about the relations of the urinary bladder, you must specify in males and then in females, and you must have good illustrations to demonstrate those relations. Don't just cram them and list them down. Outline them, illustrate them, visualize them, understand them. Cram work is not going to be to help you. That is why I ask you to demonstrate. The urinary bladder, the inner lining is the transitional epithelium lying on a lamina propria. Then it is made up of a smooth muscle known as the Mucosa muscle with longitudinal and circular fibers. And then it has the outer covering, which is the adventitia. Principally, it is the same histology like that of the wall of the ureters. When you look at the urinary bladder, in sagittal section, it has an apex which is posterior to the pubic symphysis, and this side is the base. So it has an apex, and opposite to it is the base. The base is the one which is lying against the rectum. And then this part which is joined by the urethra, not the urethra. This part which connects to the urethra is the neck. So it has an apex, it has a base, it has a neck. When you look on the inside of the neck, the epithelial lining of the neck is triangular, and it forms what we call the trigone. The inner lining of the base is triangular and forms a trigone, and at the upper corners of the trigone, that is where the ureters join the urinary bladder. So this is the apex, this is the base. In coronal section, it will show you its triangular appearance, and then this is the neck of it, and the ureters drain into it at the corners of the trigone. The superior and inferior vesical arteries, branches of the internal iliac, supply blood to the urinary bladder, a superior aspect and an inferior aspect. The detrusor muscle is a smooth muscle. That is why it's supposed to be supplied by the sympathetics and the parasympathetics. The parasympathetics come from the lower spinal cord segments S2, S3, and S4. And the sympathetics come from the sympathetic trunk. So the sympathetics cause the relaxation of the detrusor muscle and the contraction of the internal sphincters so that the bladder can fill. When you look at this urinary bladder, the sympathetics are going to cause the relaxation of the detrusor muscle so that the urinary bladder can expand and fill, and the contraction of these internal sphincters so that urine does not get out. So the sympathetics are going to cause bladder filling. The parasympathetics are going to cause the opposite, contraction of this muscle, the detrusor, and relaxation of the internal sphincters so that the urinary bladder voids. So we are seeing the internal iliac artery giving off the superior vesical artery, supplying the superior aspect of the urinary bladder, and then the inferior vesical artery, supplying the seminal vesicles, the prostate, and the inferior aspect of the urinary bladder. S2, S3, S4 segments of the spinal cord give us parasympathetics for voiding. the sympathetic trunk at the level of L2. It is going to give us the sympathetics for urinary bladder filling, and all the sympathetics and parasympathetics control the sphincters and the detrusor muscle. The male urethra is divided into the pre-prostatic, which leaves the neck of the urinary bladder, the prostatic, which passes through the prostate, and it's the one which receives the ejaculatory duct, the prostatic auricle, and the ducts from the prostate. And it's the one which can be blocked in benign prostatic hypertrophy to cause obstructive uropathy. Apart from kidney stones, even benign prostatic hypertrophy can block the flow of urine, leading to hydronephrosis. Then this is known as the urogenital diaphragm. And this urogenital diaphragm is located in that part of the perineum known as the deep perineal pouch. Inside this urogenital diaphragm, we have muscles known as the external urethral sphincters, which are skeletal, so you can control them voluntarily. These are the ones you control before you go to toilet. So that part of the urethra which is passing in between the external urethral sphincters, which are located in the urogenital diaphragm, is known as the membranous urethra, and it is the narrowest. In this urogenital diaphragm, we also have the bulbourethra, which connect to the penile urethra, and you can see the penile urethra beginning from the bulb of the penis and then the body of the penis, and it opens at the summit of the penis at the glans, and it passes through this spongy tissue, which is the corpus spongiosum. You're going to find out the length of the preprostatic urethra, the length of the prostatic urethra, the length of the membranous, and the length of the spongy urethra.